Hey guys, it's Dr. Brenda Eisenhower here. I just wanted to give you a little bit of an update. We had a lot of social media interest last week on a particular patient of ours. There's a great rescue group in town, Denver Dachshund Rescue and Transport, and a wonderful woman that heads up this rescue, Jamie. Through their big hearts, we were able to help out a dog that didn't have any options in order to help her with her heartworm disease. It was pretty dramatic. I put this video together to give you some of the medical information about this because it was kind of a neat case. We'll take you through what we did and what heartworm disease is and some of the interesting bits of it. We've even got some pictures that we'll post. But I did want to do a big shout out to this rescue group. They do great work and they took on all of the care of this dog so that her new family didn't have to have that worry. So if you're looking for a great organization to support, we're happy to share their information with you. If you're looking for a great organization from which to get a little dog, they've got a lot of really good dogs. So check them out. Bobby Sue moved from the south up to Colorado with a rescue group, and she'd been living up here and had actually even found her forever home when they noticed that she'd started urinating red. And you have animals, you know, if you see red pee, you probably have a urinary tract infection, maybe some bladder stones. They brought her in and we looked at some of her. The trouble is, when we looked at her urine, there weren't any red blood cells in there. It was just dyed red from the hemoglobin, or the oxygen-carrying protein that's in the blood. And so that tells us the blood cells are breaking apart somehow. Well, in Bobby Sue's case, because she'd come out from the south, she was heartworm positive. And she was so positive that she had worms living in her heart, actual wiggly worms that had jammed up the valves so much that when her blood was trying to pump through it, the red blood cells were actually being ripped apart and the kidneys were filtering out the parts of the red cells that were all broken up. So you can imagine if your red cells are being ripped apart, that's not good. You can't get oxygen, you can't work the way you're supposed to. In a matter of 2 days, she went from happy, bouncy, normal dog to feeling pretty dumpy. She didn't have a lot of energy. She didn't have a heart murmur when we first saw her. A heart murmur is when you can hear that there's turbulence in the blood. You can actually hear that the heart sounds don't sound right because the blood's not moving right through the heart. In 48 hours, she had gone from no murmur to a grade 5 out of 6, which means we can actually feel it in her chest. When we're holding her, you can feel the vibrations of a murmur in her heart. That's how turbulent her blood flow was. The procedure that we actually have to do to remove these worms is to go in through the jugular vein and pull them out. The jugular vein is that vein in your neck that if your blood pressure gets too high, if you get mad, it starts to bulge a little bit. You can actually see it in the mirror. If you put some pressure right here, you start to see a bit of a vein that runs right here. Well, that vein, it goes down into some other major vessels and straight into the right side of the heart. So what we did with Bobby Sue was we laid her on her side on the surgery table. We opened this part of her neck so that we could get down to that vein. We tied off the vein, and then below that, we were able to insert a pair of alligator forceps. They're called alligator forceps. Can you see this? They're called alligator forceps because the end opens and shuts like an alligator. And we could pass these through the vein, down into her heart, and then open the little mouths of these forceps and pull worms out. That's exactly as gross as it sounds. It's about 9 parts horrifying, 1 part really cool because we're also veterinarians and most of what we see is microscopic. These definitely aren't. I actually have the worms here. We pulled out 27 of them from Bobby Sue's heart with these alligator forceps. You can see, maybe you can't, it's a little hard, but it's basically like rice noodles. These 27 worms fill this whole jar with a little bit of formalin. The longest one we got out was about 13 inches long. All of that came out of this dog's heart and was less than 20 pounds in body weight happening. Bobby Sue's heart is never going to be the same after having worms live through it, keep the vessels open. All of the stress and the damage that happens from this disease isn't fixable. All we can do is get rid of the parasite. In less mild cases where we don't have to go in with a pair of instruments and pull out worms, we still have to give them a toxic drug to kill the worms, and the worms are living in the heart. When you kill worms in the heart, they can turn into clot-like problems for the dog. The dog has a couple of months of medication before we can even start to do that, and then 1 to 2 months of strict rest, kenneling, not being able to go out and play after that so that they don't actually move parts of the worm into parts of their body that's going to clot and clog up the works. So please, put your dog on monthly heartworm preventative. If you have questions, please ask us. Thank you for the time you took to watch this. Check out the pictures. We'll get them all posted along with this video. It does show all the worms stretched out. They're not too gross. We've cleaned them off. You can actually see Bobby Sue. She's a really cute dog. About an hour after surgery, this amazing dog was up, wiggling, wagging, begging for treats. She'd already eaten a bowl of food. And in most of the pictures I have of her, she's sitting there just staring up, hoping we'll give her a treat. That's the only way we can get her to focus on it. But she's such a lovely dog, and we're so lucky we were able to give her this chance.